Hello, welcome back. So in this session, we'll discuss about the various ways that HIV can be prevented. So number one, use of condoms. Remember, there are different types of condoms. We have external condom, then we have internal condom. External condoms are worn by males, and the internal condoms are for the ladies or women. So there are different types of external and internal condoms. We have latex condoms, then we have plastic condoms, we have synthetic rubber condoms, and also we have natural membrane condoms. So the latex condoms are the best. These are the ones that can effectively prevent HIV transmission when you put on the condom the right way. Then the plastic condoms, they usually have a high frequency of bursting. Then the natural membrane condoms, they have small holes that cannot prevent HIV transmission, and it is not effective against both HIV transmission and against the transmission of sexually transmitted diseases. So the best condom is latex. So the plastic condom and the synthetic rubber condoms are only used by those people who are allergic to latex, but remember that the latex condom are the best. Okay, so the precautions you need to take when you put on a condom is that after wearing a male condom, you need to check whether there is air, okay, because this can increase the chances of the condom bursting. Then during the sexual intercourse, you also need to be careful in case you feel that there's a break or the condom has busted. You need to remove it immediately and replace it with a new one. Then after sexual intercourse, so when you are removing your penis, ensure that the penis does not touch the outer surface of the condom, because your penis will come into contact with the genital fluids. Another way of HIV prevention is use of antiretroviral pre-exposure prophylaxis. It's also called PEP. PrEP. So the PrEP, antiretroviral pre-exposure prophylaxis, is only for those people who are HIV negative, they are sexually active, and they are using intravenous drugs, that is, they share needles and syringes with other people. So those people who are at high risk of getting the virus or being infected with the virus are the ones that are recommended to use the antiretroviral pre-exposure prophylaxis. So there are two types of drugs that are used. We have the pills and the shots. So for you to qualify as a person who is HIV negative and is intending to use PrEP, ensure that you follow the doctor's prescriptions accordingly. That is, in case you want to have anal sex, you need to take the medication for 7 days continuously for the medicine to have a good efficacy. Then for those who want to get involved in drug injections and vaginal sex, you need to take the medication continuously for 21 days before the act. So the PrEP actually is effective and helps to reduce the risks of HIV transmission. For those people who inject drugs, the effect is about 77%, and like those people who are having vaginal sex, which is up to around 92%. So it is effective way of preventing HIV transmission. But there are a few people who abuse this because they can take it today and they assume that they are protected and they have a condomless sexual intercourse the following day. This is risky, and you are increasing the chances of getting HIV infection. So number 3, we have decide not to have sex. Abstinence. This offers 100% protection against HIV transmission. 100% protection that you're not having sex with anyone. This is abstinence, and this is the sure way of HIV prevention. Then number 4, get tested and treated for other STDs. As we had discussed earlier about the risks of HIV transmission, those who have STDs have a higher risk of HIV transmission and also a higher risk of getting the infection. Okay, so it is always recommended to do annual medical checkups and also include the STDs even if you don't have the symptoms. Then number 5, if your partner has HIV, encourage them to get tested and get treatment. If you are HIV positive, you might be asking yourself, what do they need to test? Okay, they need to test whether your immune system is functioning properly. That is why they check the levels of certain types of cells in your body. They are called the CD4 cells and CD8 cells and CD4 and CD8. So they will also test for the number of viruses in your blood. This is called viral load. Then if you are HIV positive, you need to take the medication appropriately in order to suppress the virus in your blood. If the number of viruses in your blood is low, there will be decreased or less chances of transmitting the virus to another person who is HIV negative. So let's discuss about discordant couples. A discordant couple is a couple whereby one person is HIV positive, another person is HIV negative. A discordant couple might want to have a biological child. So for this to happen, you need to go and see a doctor. So what they will guide you, or what they will tell you to do, in case the husband is HIV positive, we have two scenarios. In case the husband is HIV positive and the wife is HIV negative, and also in case the husband is HIV negative and the wife is HIV positive, there are different ways that can be used in order to help you guys have a biological child. That is, so if the husband is HIV negative and the wife is HIV positive, so what will happen? The husband can donate sperms and the wife can be given through in vitro IVF, in vitro fertilization, IVF. So you will have a baby who is HIV negative. The father is uninfected and he has managed to have a child with his wife, okay, through sperm donation. So the wife will continue to take HIV medication during pregnancy and also after pregnancy. Even after pregnancy, after delivery, the child, the newborn, will be put on antiretroviral therapy for at least 6 months, and this increases the likelihood of the child being HIV negative as well. So in case the husband is HIV positive, this is scenario 2, and the wife is HIV negative, so what will be done is this: the husband will be given highly active antiretroviral therapy. This is called HAT, highly active antiretroviral therapy, and the wife will be given antiretroviral pre-exposure prophylaxis for 21 days before they have a condomless sexual intercourse. HAT. So the husband is given HAT. This is a highly active antiretroviral therapy. This helps to reduce the number of viruses in the blood to a point that it is undetectable. So at this point, there is low risk of HIV transmission. So they can have condomless sexual intercourse during ovulation to increase the chances of conception. So another thing that is done, other than the husband taking highly active antiretroviral therapy and the wife taking the antiretroviral pre-exposure prophylaxis, the husband can also donate sperms, and the sperms are taken to the lab, whereby the sperms will be washed to remove semen and also to remove cells that have been infected with the virus. Then after that, they do IVF, and also they can also do intrauterine in vitro fertilization, the IUI. So if you are a discordant couple, you can still have a child who is HIV negative, and the current technologies have actually helped in order to achieve this. Thank you for watching and have a good day.